The conversation around glaucoma is shifting to earlier intervention with a focus on efficacy to maximize the impact of MIGS surgery. At ESCRS 2025 in Copenhagen, we caught up with Drs. Obeda Kailani and Ahmed Elshinnawi to explore how OMNI, a minimally invasive solution, is helping make that shift possible. From clinical confidence to real-world results, this is what bringing data into practice looks like.
When I have a patient undergoing cataract surgery on at least 2 medications with mild to moderate glaucoma, I would consider OMNI as one of my first-line treatments.
The OMNI device addresses all the 3 outflow resistant points. It addresses the trabecular meshwork, it addresses the canal or Schlemm and the collector channels. You can do either 360 trabecular canaloplasty, you can do 180 goniotomy, you can do 360 goniotomy. You can tailor that according to the needs of your patients. It leaves no implant behind. That's a great plus, so you don't have to worry about the endothelial cells. And finally, you spare the conjunctiva for like traps and tubes later on as the disease progresses. I first observed OMNI surgeries at the Mayo Clinic in Florida. I was really struck by how consistent the results were. Typically, I'm seeing a reduction of the IOP around 6 to 9 millimeter mercury, along with 1, 2, or sometimes even 3 fewer drops. They mirror results of the Gemini study, and it reassures me actually that I'm doing that the right way when the real-life data and the study data are the same.
The systematic review and meta-analysis is the first of its kind for OMNI for trabeculotomy and canaloplasty. We did a systematic review of 22 studies and a meta-analysis on the outcomes, both clinical efficacy data as well as humanistic and economic factors. And what we found actually is that the intraocular pressure reduction achieved from OMNI was not only significant, having 89% of patients achieving at least a 20% pressure reduction or more for a 12-month period, but this was also sustained for the 24-month period. The intraocular pressure reduction and reduction in medication impact is not only present in patients who are undergoing combined surgery with cataracts, but it also occurs in standalone patients as well. What we also found in the systematic review is that up to 78% of patients were medication-free at 12 months, and at 24 months, up to 70% were medication-free, which is very significant for our patients. The systematic review provides a reassurance to colleagues and clinicians willing to adopt this technology that the technology not only works in the short term, but we've demonstrated at 24 months that there is a sustained response with this treatment.
In Sight Sciences, they really offer an excellent training program. So they walk you through everything from the theory to dry labs, wet labs, and how you do the surgery. They offer master classes, and you basically discuss everything from zero until how everything goes after the operation and so on. So you feel really comfortable, you're not surprised, you're not having any problem during or after the surgery.
One of the unique things that I think with regards to OMNI is that we've had several iterations, and over time, by working with industry, we've managed to actually feed back to the industry partners and specifically Sight Sciences in order to develop a device that is much more ergonomical, and is one of the easiest canal-based procedures that I do.
From data to daily practice, OMNI is helping surgeons take confident steps toward earlier intervention for their open-angle glaucoma patients. As long-term results and new studies continue to emerge, the story of MIGS is just getting started. For more on OMNI, visit omnisurgical.com.